Hello. After the last email we sent out with information regarding transportation and updates to our reopening routine that's coming up, we received some questions around the flow chart that we worked with Public Health on that describes the protocol for symptomatic or positive cases of COVID-19 in school for students or staff. So I wanted to do a video that kind of clarifies some of that. This was an update that was given to us recently. There were some changes to the original thoughts, so this video hopefully will clarify that. So essentially there are multiple symptoms. Those symptoms are listed on the flow chart, and just for reference, it is this flow chart. We'll post this. Actually, it's already posted on our website through our frequently asked questions document, so you'll be able to see that. But this chart is for when students have symptoms in school. I'll talk for a minute about if they're home and they have symptoms, but this is if students have symptoms in school. So a student comes to school, their temperature was taken, they make it through, they're fine, but in the middle of the day they pick up some symptoms, let's call it the runny nose, vomiting situation. So if that happens, the protocol that is given to us by the Department of Health is to isolate the student and then send them home. When they go home, they need to have medical attention. To return to school, those students need all three things. They need, number one, they need to be symptom-free. Number two, they need a doctor's note that says they are good to return to school. And the third one, which I think is probably the biggest change, is a negative COVID-19 test. Again, this is if students have symptoms in school. That's what would be required for them to come back to school. The other side of the chart talks about if there's a positive case. If there's a positive case, there will be some work with Public Health and ourselves to determine the best process, but essentially the steps for that situation is that if that student was within any other students within 6 feet for longer than 10 minutes, regardless of mask, they will be contact traced. If the students are in a room, which essentially say a classroom, for 60 minutes or longer, that entire class will be falling under the public health quarantine for 14 days and monitored for symptoms. That's why it's so important on the front end to make sure that students are coming to school with symptoms. So those were two big changes that came our way from the Department of Health that we are obliged to implement. So the question that probably people are really looking for, so if I have a child that wakes up and they have a runny nose, or let's say they vomited, if that happens, what do I do? So in that case, you should keep them home, okay? Because if they come to school and they have those symptoms, they'll follow that protocol. If you keep them home, it's suggested that you contact your medical professional, okay, your doctor, and talk to them about what is the next step and what happens, because they'll ask you some questions, and they'll determine what the next step is for you in that case. If they, depending on what the doctor decides, and if they figured out what the situation is and they don't need to be tested, they can come back to school. But the student needs to come back to school without symptoms. So that would be a doctor-parent discussion in regards to what the next steps are. So just wanted to make sure that that piece was understood. The chart that was put together was when students are in school with symptoms. We would follow that chart. When they're home, that's a parent call to a doctor to determine, because you may be concerned about potential symptoms there. So I hope that clarifies. Obviously, if you have questions, feel free to give us a call or send an email in, and we'll work specifically on some various situations. Generally, if there is a chronic condition that a student has, it is a very good idea to get information from your doctor to be able to share with school so that the nurse can make a decision based upon that chronic information. So that would be a step that you could take right now that would help your child who may have symptoms in school. So again, that's for chronic situations. and we want to make sure that that information is shared. So I hope this has cleared some things up. Thank you, and we'll see you soon.